Hello, this is my DPT portfolio video by Luke Arnold. Just to introduce myself, I'm part of the St. Ambrose graduating class of 2025 to go through some of the clinical experience settings that I've been a part of. I've done outpatient orthopedics at Rock Valley and Davenport. I've also went up to Jackson County Health in Maquoketa. At Rock Valley, we did a lot of work comp cases, which in the curriculum we didn't really dive too much in depth on, so it was pretty interesting to get a chance to be a part of that. In the acute care setting, I've done rotations at Great River in Burlington, Iowa, and Unity Point Trinity here in Bettendorf. I've also went to inpatient rehab at Genesis West. All those were actually really interesting and pretty neat to be a part of. To go through just my mission and vision statements. My mission is really, in the beginning, I just wanted to help people move better and live their life to their full, to allow them to live their life to their fullest without pain really being a limiting factor. This has really evolved as I've progressed throughout the program. It's evolved into helping people take ownership of their rehabilitation and help them build lasting lifestyle change to improve their overall function and quality of life. My vision statement was really just to be a compassionate and evidence-based clinician who can really bridge the gap between rehabilitation on our side and also the education piece to really bring it down to the level of the patient so that they can understand it and take it with them when I'm not around. So I want to create an environment where patients feel heard, supported, and motivated to go through the rehabilitation process with them, and hopefully that'll lead to better outcomes and better progress for the patient overall. My philosophy for PT practice. My philosophy has really developed through both all of the coursework we've gone through and through clinical experience. I thought initially that rehabilitation was really about exercise prescription and just picking the best exercise, and that'll be what the patient needs. That has also evolved. Now I really just see it as more of a partnership, blending our clinical reasoning, empathy, and education to help give patients the tools that they need to make the appropriate lifestyle change so their injuries really no longer hold them back from reaching their goals, and they can go out in the community and do what they want and help them out, really. I guess one moment that has shaped this philosophy, my view, was really just being able to work with many individuals, whether that be through the pro bono clinic that we had. I also got the opportunity to work with an individual who experienced spinal cord injury. Really just being able to see him and be there as he worked through the setback and really getting back to a functional life and see him reach his goals. It's been absolutely eye-opening and a great honor to be a part of his journey, really. That experience just kind of has reminded me how rehabilitation really needs to look at the whole individual, not just the single injury that happened. My plan for giving back, I hope to give back in the way of really community outreach and education. I plan on conducting fall prevention classes to better help the community I work in and educate older adults to reduce their fear of falling and to help improve their quality of life. I also plan on staying involved in continuing education, as we all do. Evidence-based practice is one of the core values of our profession, so I, much like everyone else, want to keep learning, collaborating, and hopefully one day in the future I could possibly contribute to the continuing ed courses and help clinicians stay on top of it. And not only will that help them, but it also help me stay accountable and push everyone in the right direction. This plan was influenced by my experiences throughout my long-term clinicals, just watching clinicians conduct joint classes to educate people prior to their joint replacements, as well as getting to be a part of in-services that were conducted by clinicians to help their fellow clinicians stay on top of the latest research so they can provide the best care they can for their patients that they see. Thank you. This was my portfolio video.